Welcome to Paragon Behavioral Health Services. In this video, we will guide you through the process of entering a new client into our electronic health record system, Theranest. Let's get started. In this training, we'll cover how to log into Theranest, adding a client into the system, entering demographics of the client into the chart, adding insurance into the chart, which forms will need to be sent at intake, and assigning a clinical staff member to the client's case. First, open your web browser and go to www.theranest.com. Click Login at the top right-hand corner of the screen. Log in using your credentials to access the Theranest dashboard. Before adding a new client, it's important to ensure they are not already in the system. Go to the client list and check both the current and archived lists for the client's name. If the client is not found, click on Add New Client to start the process. Fill in the first and last name, then click Save Client. Fill in the client's personal details, such as mobile phone number and email address. Click here to generate a unique client number for the new entry. Then enter the address. Next, scroll down to enter the client's date of birth and legal sex, then click Save. Next, navigate to the Bill To and Insurance Info tab. Scroll down to the Manage Insurance section and click on the blue Add New Insurance box. Then, enter the effective date, which will be the day you are entering the insurance, and then click the drop-down box and select the correct insurance carrier. Next, enter the insurer ID number and copay amount. Once you have done that, scroll back to the top and click Save. Next, you'll invite the client to the client portal by clicking here. Once the client completes the forms, you'll find them in General Documents. Let's talk about which forms to send. Next, send the client intake forms via the portal. Be sure to send all the forms on the checklist. Client rights and responsibility. 1. Consent for treatment. 2. Credit debit card payment consent, GAD 7, PHQ 9, informed consent for psychotherapy, notice of privacy practices, patient financial responsibility statement 1, and telehealth treatment consent. Once the forms are completed, enter the client's credit card information into Theranest. This information can be found in the intake forms. Follow up with the client if the credit card information is missing. For clients who are attending a session for autism testing and diagnosing, send the following forms. There are slight variations on this list, and make sure all are sent. Client rights and responsibility. 1. Consent for treatment. 2. Credit debit card payment consent, psychological assessment, informed consent, notice of privacy practices, patient financial responsibility statement 1, and telehealth treatment consent. Once the authorization is obtained, you'll need to enter the authorization number. Go to the Bill to Insurance tab. Scroll down and click Add New Authorization. Click the drop-down box and select the insurance. Click the next drop-down box and select Units. Then enter the authorization number and then the start and end dates for the authorization. Then, type in the insurance company and select both the in-person and telemedicine options for CPT codes 96130, 96131, 96136, and 96137. Then enter 15 units per period. Lastly, navigate over to the Assign Staff tab. Type in the clinician's name, select, then click the plus assign button, then click Save. And that's it! You've successfully entered a new client into Theranest. If you have any questions, feel free to reach out to our support team. Thanks for watching and have a great day.